If you've noticed that your baby's eye is constantly watering, then they may have something called a blocked tear duct, and in this video I'm going to teach you how to safely and correctly perform a tear duct massage for your baby at home to try and help solve this. Now, blocked tear duct happens in around 5% of newborns, so it's a really common problem, but thankfully it doesn't damage the eyes or the vision, and it's actually harmless. In most babies, the condition clears by itself before they're 1 or 2 years old, and in this video we're going to cover symptoms of a blocked tear duct, a demonstration of how to correctly perform a tear duct massage, a brief overview of what surgery for a blocked tear duct involves, and finally an important condition that you should be aware of. As ever, each section of the video is timestamped and it's split into chapters. So just so we know the area that we're talking about, the tear duct is a little tube that helps to drain tears from the eyes, and it just sits next to the nose here, and you can see a diagram on screen now. Now, this is important because it's where you're going to be performing the massage, and in quite a few babies and infants, this tear duct can get blocked, and usually it's just because a bit of membrane, which is another word for tissue, hasn't fully opened up. Now, if this happens, tears can overflow onto your baby's face, and it may look like their eye is watering all the time, or that the eye is infected. They may have some clear or yellowish goop or crusts on their eyelids or eyelashes. Now, because other things can cause these signs and symptoms, like infections, it's always worth getting your baby checked out by your doctor to make sure everything's okay. But if it is a blocked tear duct that's causing these symptoms, then a tear duct massage, also known as a Crigler massage, can help open up the blocked duct so that tears can flow through it. And now we're going to cover a practical demonstration of just how you can safely and correctly do this at home. So if your baby's got stickiness and discharge around the eye, you can gently clean this away using clean water and cotton wool. Because you're going to be putting your finger close to your child's eyes, first of all, make sure that you thoroughly wash your hands with soap and warm water before and after the massage. Next, you want to place the tip of your index finger against the side of your child's nose in the corner of the eye with the blocked tear duct. Make sure that you support your child's head when you're doing this. You want to press firmly and move your index finger in short, downward strokes 3 to 5 times as we're demonstrating here. Now, having a blocked tear duct on both sides is uncommon, but if this is the case, just repeat this step on the other side. And you should repeat these steps 3 times each day in the morning, noon, and night until it settles down. Your child may also need eye drops, and if this is the case, the doctor or your health provider will give you instructions on what, how, and when to use them. So what happens if a blocked tear duct persists despite this technique? Well, the good news is actually that 90% of children who've got a blocked tear duct will find that it resolves with this simple technique without the need for any further intervention. But if the symptoms don't get better by the time they're 12 to 18 months of age, then an eye specialist called an ophthalmologist may consider performing a procedure called syringe and probing. Now, this will be done under general anaesthetic, meaning that your child will be asleep. And the procedure uses a very thin instrument which is passed into the tear duct to open it up. And the good news is that it's usually successful. Finally, what should you look out for? Well, in very rare cases, a tender red lump or swelling can appear in the inner corner of the eyelids. This can indicate a serious infection of the tear sac known as dacrocystitis, and you would most certainly need to see your doctor about this if this develops. And I've put a picture of this on screen for you to know what it looks like. So if your child has experienced a blocked tear duct and you found this video helpful, or if you just want to share your own experiences to help others, please do leave a comment in the comments section. This is really valuable and I would welcome this. As ever, I've included all of the resources used to make this video in the description box. These contain lots more useful information, so please do check those out if you want to learn more about the topic. And if you did enjoy the video and you learned something new, please consider liking it and subscribing to the channel for weekly medical education videos. Until next time, thanks for watching and bye.